My name is Tracy Wade, and I'm the project lead for the New Brunswick HealthADAPT project on behalf of Public Health New Brunswick. The title of our project was Adapting to Climate Change in New Brunswick, Health Vulnerability and Adaptation Assessments with an Urban and Rural Perspective. Our intent was to develop a New Brunswick guide for conducting the climate change and health vulnerability assessments by pilot testing Health Canada's process in two communities in the province, one urban and one rural. We had a number of objectives. We wanted to improve the understanding of the link between health and climate change and develop more New Brunswick specific information on this link. We wanted to provide adaptation strategies on how to reduce health impacts and inequities in the face of climate change, create a baseline for information from which to monitor future change and health impacts. Our hope was to develop bilingual communication materials, as we're the only bilingual province in Canada. Finally, to ignite the New Brunswick public's interest in climate change and mobilize New Brunswickers to take action at a local level. We developed a detailed background paper that examined the link between climate change and health outcomes in New Brunswick. But with the onset of the pandemic, we had to pivot and readjust some of our objectives to focus on the community side of the process as opposed to looking at the health system itself. So we selected two pilot communities. Our urban community was the city of Moncton, with a relatively concentrated population of approximately 70,000 people in southeast New Brunswick. And our rural pilot was the Chaleur region, with a population of around 30,000 people, but spread out over a very large geographical area in northern New Brunswick. Given COVID restrictions, we conducted our community engagement online. We did a public survey, established community working groups, and then conducted interviews with organizations that represented vulnerable populations. So the Mental Health Association, Family Resource Centers, the Homelessness Steering Committee, groups like that. After gathering a wide range of data from environmental and health sources, we developed vulnerability reports which outline the environmental and climate risks projected for the pilot areas, as well as a baseline health status of the population related to those risks. So the extreme heat exposure was measured against heat-related illnesses, for example. The report also indicated future health risks given the projected changes to the climate to 2100. We then held a series of online focus groups with stakeholders to discuss adaptive capacity. From there, an adaptations report was prepared for each pilot community that included a range of activities that could be undertaken to adapt to the projected climate changes and reduce impact on health, particularly for the vulnerable populations. In terms of key lessons learned during our project, so COVID was both a curse and a blessing. It effectively derailed a few key aspects of the project that we simply couldn't conduct because most senior health officials and practitioners were simply not able to spare time or energy for non-COVID related projects. However, COVID is also teaching us how vulnerable our populations at greater risk are, and it has brought to light inequities in the social systems. I have to admit, conducting the data analysis was challenging. There were so many sources of data, yet so many restrictions on the use of the data for privacy reasons that it made the entire process quite a challenge. This was especially true in rural case studies, as the numbers were simply too small to be able to do any analysis. I know from that experience that it would have been next to impossible for communities to be able to conduct a climate change and health vulnerability and adaptation assessment on their own without significant assistance from people in the health system, most of whom are already quite busy. Despite the various obstacles, though, we were able to complete the pilot studies and meet most of the original objectives of the project. And we have some really practical deliverables that can be used by others who might wish to look at health and climate change in their local climate change adaptation plans. As a result of the data challenges and the pivots that we had to make because of COVID, we ended up redirecting some of the project funding to a province-wide analysis on population sensitivity to climate change. Basically, this will provide baseline health and sensitivity data that can be used to understand how sensitive a community will be to various impacts to climate change. To overcome the data restrictions for our very small communities in New Brunswick, it's being prepared for the 33 community groupings that are already being used by the New Brunswick Health Council. So these community groupings are already engaged in processes to review health data and develop health action plans. The ability to add climate change data will be very helpful for informing local level awareness and action on climate change in the years to come. Health Canada funding allowed the team to have more meaningful conversations in New Brunswick on the impact of climate change on health, particularly early on in the project. We also developed a New Brunswick HealthADAPT infographic. The goal was to show how adaptive communities can reduce the impact of climate change on health. It focuses on simple messaging related to adaptation actions that address health impacts of extreme weather and extreme temperatures, air quality, water quality, food security, vector-borne diseases, and UV radiation. In terms of the impact the project has had in our jurisdiction, there is certainly more knowledge here now, particularly for our pilot communities. Local decision makers might have realized that some type of adaptation was important for, say, flooding, but now hopefully they understand that there are likely health implications to their adaptation decisions as well. So we've tried to show them if they tweak some of those original adaptation measures, that the health impacts can also be addressed more effectively. Of course, there's still lots of work to be done. I think HealthADAPT is just the start of the conversation in New Brunswick. In terms of what's next for the project, New Brunswick's Climate Change Secretariat has offered to host the HealthADAPT products on its website so that communities throughout the province can take a look at them and possibly make use of them in the future. So tools like the infographic, the Adaptations Actions database, and the process tools that we were able to create will all contribute to developing a better understanding of health impacts from climate change and inspire communities to take action. In terms of what other health authorities should know when embarking on this, well, the data is the real challenge, but it is needed to understand how to measure if adaptation measures are having an impact. So health authorities need to figure out the best way to establish those baseline numbers and then conduct surveillance and monitoring over time to measure them.